childcare, it's really important for any child to have their needs met. With special needs, the first thing that comes to most people's minds is an official diagnosis. But other examples that come to mind would be if they require special milk and that you just want to make sure, or maybe he can't have pork, a child can't have pork, or needs a special lotion. Those types of information would be maybe a request or an actual order, but things that would be something that child needs. There might be also things that are just little tricks for anyone that's working in the classroom to help a child be successful. Maybe it's how you've learned, or things that you know that work really good, and how you ask a child to wash their hands, or maybe you know a specific child doesn't like such an item in the room, or to do such a procedure or something like that in the classroom, and you've found a way that works really well between you and the child. So any of those special notes would also be something that would be helpful. So with that, what things I would like you to do or to think about doing would be to have a clipboard, and a clipboard with a cover sheet. Underneath that cover sheet, you would have the child's name, and then you would have what the child's diagnosis is or request, something, whatever special care or need that child has is identified. So with Adam Zig, it would be asthma. And then with Adam, it states here, nebulizer above cubby, that's where it's being kept, and then the medication in the cupboard above the sink. So then that way, if I know I'm working in this classroom, I know Adam has asthma, I know what Adam looks like because I have a picture of Adam, and I also know if he does have trouble, I also know where to find his nebulizer and the medication, so that is easily identified, and I don't have to worry about wasting special time or important time trying to find those items. And then with Fred here's his picture. He has Down syndrome, he has a developmental delay, he's receiving therapy. And then with Sally Johnson, she's lactose intolerant, she needs lactate milk. So I just know that that's something I need to make sure at mealtime she always gets her milk. If they did have a care plan, that you would also put that underneath on the clipboard as well. So if they had a care plan that you have a copy should always be within the office as the master copy, but then it's also recommended to have a copy in the classroom. And if you do have something like an emergency medication, like an EpiPen or an inhaler, nebulizer, that you always keep a copy of the care plan with the medication too, just because those are your instructions, and that is something you should always refer to if you ever did need to give that child the medication. So underneath there, like I said, it would be a care plan. If they have notes from therapy, anything that would be helpful for you as instructions for helping you give the best care to that child. Everything would be listed under there, kind of like one-stop shopping. Another thing to think about is your storage of anything special that the child does need. So in the case of the EpiPen or a nebulizer or any other emergency medication, that you need to have unlocked but out of reach. So a high cupboard would be a great place because, like I said, it's something that would not have a lock on it, but it's not in the reach of any children. So a good thing that you could do would be to put that on the front of the cupboard, so that way you can put that there, and then underneath on the sheet you would state that the nebulizer is found in the cupboard behind the clipboard. So then that way it's easily found, you know where to find it. If you also meant that you couldn't put that on the front of the cupboard, you could hang that somewhere else. But then once again, underneath there, I would like you to state where that medication is found. So it might be in the cupboard above the sink, or it might be the cupboard above this item. And then another thing that's helpful is you might want to just put some kind of a label or a sign on the front of the cupboard door that says EpiPen here, or first aid, emergency supplies here, just so that anyone that's coming into your classroom, that would be easily identified and you could find it easily. Again, it's just those little tips that might help you as a staff member walking in, that if you're going to be subbing for that person in the classroom, but it also ensures the best care for the child and makes for a much more successful day.